Assalamu alaikum. Shabab, hi, it's Reem Mudawi, ST4, Psychiatry. I'm just waiting for people to comment so I can start. أول حاجة, can you hear me clearly? Can you see everything? I sent a file برضو, I uploaded it في الgroup that you can follow along with this talk. I'm just hoping to get confirmation من الناس if anyone's online. هاشم السلام عليكم شايفاك you joined بس كنت عايزة أشوف الصوت واضح الصورة واضحة all good okay تمام I'm just checking okay, I'm seeing some people coming online I'm just gonna introduce myself قبل ما أبدأ عشان أدي الناس فرصة تخش أول حاجة بسم الله الرحمن الرحيم أشكر SJDA group يعني the group's been doing a lot of really good things there's lots of videos a lot of things that people are doing in Sudan وهنا بالنسبة لtraining في UK so I hope it's really helpful just a little bit about myself أنا ريم مدوي تخرجت batch 11 من مامون and I've been working in the UK since 2011 so وحاليا I'm doing child psychiatry I'm an ST4 هنا في لندن فبدأت يعني دي أول سنة لي في الhigher training For today's talk, first of all, just in case those haven't noticed, on the group there's a file that I uploaded, which is basically an outline of the talk that I'm doing today. So inshallah, in the next 45 minutes to an hour, these are the points that I'm looking to cover. So first of all, psychiatry, just a bit about the history, just because I think it's interesting. I think people have a lot of misconceptions about what psychiatry is. Tanian, I'm going to be looking at services, how they're set up in the UK, because that will, it's important to know how settings are. وبعدك طبعا أهم حاجة I think that most people are going to be interested in or asking lots of questions about is training. كيف أخش training, كيف to apply for core training and higher training. And then after that, inshallah, just briefly, I'm going to be talking about CCT, completion of training, and what the alternative routes are. There should be inshallah enough time for questions and answers, a Q&A session. There's a few people who've already posted some questions and I'll try to address them, and along the video if you have anything that you really want me to answer in the middle then I'll do that. Tamam, okay, let us begin. So psychiatry, why psychiatry? So I think personally I will advocate for my specialty. It's really interesting. I think it's one of the only specialty that looks at everything to do with the individual, their background, their culture, how they grew up, what their social support is. You're looking at an illness in the context of a human being and their life and how they live. فهي حاجة مهمة شديد. A lot of people think about psychiatry as a middle ground between neurology and psychology, and I'll talk more a bit about that. بالنسبة للtraining والشغل في UK, it's يعني psychiatry هنا يعني I'm gonna move on to talk a little bit about a setup. Basically إنه زمان كان there's lots of really old asylums, really old. I think most people have that image when they think of psychiatry. They think about people in straitjackets and الحياة القديمة دي. فالحياة دي it did exist unfortunately a very long time ago, but we have moved a long way from that. So a lot of these asylums have closed. Emphasis of care for the UK has been to provide care for mental illness in the community. يعني زول ما تخش المستشفى unless they really, really need to, and if they're really acutely unwell. The rest of the time, the idea is to support them in the community. And just a few statistics that I think will just put things in perspective. I'm just checking the date. So on the 9th of May in 2017, the WHO released a statistic that suicide is the second leading cause of death between 15 to 29-year-olds. So that's like a huge number. And second of all, there's been a lot of, here in the UK, there's been lots of talk in the media and, access and it's kind of relevant that I'm doing it today. So this happens to be Mental Health Awareness Week in the UK, so it's kind of cool that I'm doing it today. But anyway, so basically, there's a huge shift to focusing care for mental health. There's been a lot of underfunding في البلد وبرا يعني الموضوع, not because people don't think it's important, but there haven't been, for various reasons, mainly being stigma, there hasn't been a lot of resources allocated to mental health. People have difficulties in coming forward, getting treatment. It's a big deal. يعني mental health بالذات في البلدي, we've been fighting for resources when you're comparing yourselves to the key hospital and the settings وكذا. That's just kind of a background about mental health, where we are in the world today, and the focus of how the NHS works وكذا. Let me move on to talk about training and what it's like to be a psychiatrist. So why be a psychiatrist? What kind of doctor wants to be a psychiatrist, and what other opportunities can a career in psychiatry lead to? I just thought I'd try and answer these questions before I talk about the specific routes of training per se and التفاصيل اللي قلتها قبل. So why be a psychiatrist? Because it's awesome. But no, seriously, why be a psychiatrist? I think if you are the type of person that likes to get to know your patients, that likes to really solve a problem, and you're also very comfortable with not having all the answers, you have to be someone who can really handle the grey. Psychiatry is not black and white. It's not surgery. It's not medicine. There's no blood test that will give you an answer for a disease. It's very much your ability as a physician to develop a rapport and relationship with your patient to figure out what's going on. And I think it's a privilege, to be honest, because in psychiatry it's one of the few specialties where you actually sit down with someone and they don't tell you about their chest pain or their cough or their headache or all these types of things. They're telling you about really personal things. They're telling you about the voices that they're hearing in their head. They're telling you about the fact that they wanted to kill themselves last week. فحاجات حساسة شديد. So I think it is a privilege to be able to get to a point where someone is able to feel comfortable to tell you all of these things so you can help them. So that's why I think people want to do psychiatry personally anyway. So what other things can psychiatry lead to? So a lot of people, زي medicine and surgery, they're very academic and they want to do research in psychiatry. You can do that. There are academic career pathways. فغير core or specialty training, you can go down an academic pathway. And also public health. So public health is a new thing with mental health, and there are different masters and degrees that you can do if you don't just want to stick purely to clinical life. That's just في كلام بس معلش, and I know I spoke for a bit. I just wanted to check, is there صوت لسه واضح? I'm not speaking too fast. I have a habit of doing that. Okay, تمام, I'll continue. So core training, how do you get into psychiatry? I'll start by trying to answer a question that people often ask. انت لو ما قاعد في البلد دي, or if you are, and if you haven't done a job in F2, does that mean you're not going to be successful by applying to psychiatry? So is completing an F2 post in psychiatry essential? The answer is no, it's not. Obviously it'll be really helpful, it's desirable, it'll increase your chances, but it will also give you an opportunity to familiarize yourself with the specialty. And I was very lucky, alhamdulillah. In F2, my last job was psychiatry in Hull, excuse me, in Hull, Yorkshire Deanery, my last job in F2, and then نزلت CT1 طوالي. So it was a smooth transition, and doing an F2 job and a CT1 job is pretty much the same. Your responsibilities are very similar. So it's, I would, if you can, that's great. But هم ذاتهم يعني في a specialty program, they're very aware that not everyone has the opportunity to do an F2 job or an F1 job in psychiatry. So what do you do في الحالة دي? What can you do to give your chance, to increase your chances of succeeding in an application? There's a number of things. منهم الناس اللي قاعدين في البلد دي, they'll be familiar with the concept called doing a taster week. So that basically means you're in your F2 job and you want to try a week in a different specialty that you haven't been exposed to. ودي ممكن يعني تتنظم through your deanery, through your postgraduate department, and you spend a week in another specialty. So spend a week in psychiatry. If you're doing an audit or any teaching, anything that's يعني you can consider it as something extra. فبasically أنت في النهاية what your goal is when you get to the interview, when they're asking, and they'll always ask this question, the main focus of the interview is why do you want to choose psychiatry, and what have you done in your career thus far to show that you're interested, that you're committed to a career in psychiatry. So even if you haven't done an FT job, if you've gone out of your way to do a taster, to do an audit project, to present a poster, to conduct some teaching, أي حاجة أنت ممكن تتكلم عنها دي هتساعدك, and this will definitely help you in the interview stage, which I'll talk about. So coming to the application process for core training. So this usually happens in the early part of F2. So in your first placement, you're doing your application forms for core training, and you're looking at the different specialties. I'll talk about my personal experience. So I applied for GP and core training. It's applications is very similar. يعني أول حاجة you need to think about your eligibility. Eligibility is simply your foundation competencies, and then you you go through the form. I put في الdocument أرسلت عليكم في الجروب خدت link for the recruitment website. Excuse me. I would really advise people, like, I know lots of time we get sent lots of documents كلام كتير, لكن when you're applying, a person specification is really important to think about when you're applying for core training, because basically you are basing your application based on this. For course person specifications for CT1, you'll have a whole list of different domains that you're expected to be able to show evidence that you've covered. For example, you'll have essential criteria and you'll have desirable criteria for different domains. And here, مثلا, MDT working, you'll have domains about clinical practice, about probity, you'll have things about teaching, research, leadership, management. فكل حياة في الابليكيشن فورم اللي بتلقاه للسبيشالتيز التانية يعني انت مفروض تكون غطيتها. It's basically يعني if you think about it from the person who's looking at your application لما تجي للinterview, they have a checklist, they're going through the person specification to make sure that you're matching. يعني انت لما غطيت الحياة دي كلها انت ما حتمشي لقدام. So if you look at the person specification, that will be really helpful in giving you an insight into لو عندك gaps, مثلا ما عملت teaching, ما عملت audit, يعني you'll have time to think about what you need to do to improve your application. You looked at your person specification. يلا الحاجات الناس في زول سألني what can I do to increase my chances. If you've covered the main things they've asked you for, anything extra obviously is going to help you. If you've been published, if you've done research, if you have a publication, if you've done a poster, presentation, it doesn't have to be like an international conference. يعني ممكن يكون حتى presentation في local teaching, or if it's a regional teaching. يعني you have to get a bit creative when it comes to your application. I'm not saying to embellish or lie, but I'm saying that it's about being creative about what you have in your CV and how you can make it work for you and apply it to an application for psychiatry. From an application form, يلا عملت الحاجات دي. يلا there's been some changes with the application process the CT1 since when I did it. So أنا نزلت CT1 في 2013. I think it was either last year or the year before. I think 2016. They changed the style بتاع الapplication process في المرحلة بتاعت الانترفيو. So زمان there used to be 3 stations. منهم كانوا portfolio station, commitment to specialty, clinical scenario, وبرضه كان في a written exercise that you were supposed to do. Now they've changed that. They've scrapped one of the stations ودخلوا حاجة اللي اسمها SRRA exam. And I'm trying to remember what that stands for. Like it's basically an exam that looks at your clinical knowledge, your basic clinical knowledge, and also ethics and questions around professional dilemmas. فالامتحان SRA that it's not just for psychiatry. I think برضو if you're applying for GP and a few other specialties, you'll have to sit it. So if you look at the document أرسلت عليكم, inshallah there is a link that talks about the SRA exam and when to do it and how you how you proceed بعد ذاك. يلا الحاجة اللي ممكن أقولها المهمة شدي إنه ال SRA exam, which is new by the way, just to say I haven't done it. لكن I've asked people who've taken this exam and they've said it's pretty straightforward. It's basically قريب من Plab 1. It's your basic medical knowledge. إضافة ل professional dilemmas وال ethical scenarios والحياة دي. فحتى in the link there's a few examples of the type of questions. My understanding is, and please correct me if I'm wrong, like in the SRA exam counts for 30% of your application. It's يعني basically I would say is if study well for it, it's easy marks. If you can boost your application by تكون ضامن كم 20 أو 30%, when it comes down to the interview, it will make a huge difference, especially when it's about choosing location, about an opportunity اللي ممكن تجيك. So I'm going to just talk about the interview now. I'm just checking, am I going too fast? في زول عنده سؤال? Should I carry on? شايفة الناس, people are joining. Yeah, no, okay, I'll continue. So let me talk about the interview. So up to this point, just a quick recap. So you've basically verified that you're eligible of application process. You've submitted your application, and then you'll get an invitation for interview. Let me just say, and I think the statistics will back me up. If you look at competition ratios, fill ratios, battle jobs, psychiatry has it's still a very underfilled specialty. يعني even بالرغم إنه people don't always get jobs, that's mainly because they didn't meet the criteria, or like in psych needs people, like seriously, even in London right now there's lots of vacancies. And also I would say that بالنسبة للمستقبل يعني further down the line, if you're thinking about staying in the UK and completing your full training at consultant level, which I'll talk about later, there's really good opportunities to go into jobs. فما يعني I don't want to like diss other specialties, but I know that they are a lot more competitive, and not to say that, and the reasons, and there's multiple reasons that I could talk about that forever. Like in him, it's worthwhile looking into. If you do want to pursue a career in psychiatry, I will say the benefits لقدام إنك تلقى شغل وتلقى CCT post, it's quite high. So I'll talk about that anyway. So talk about application, interview, at SRA exam, which is part of the application process. يلا interviews out. So interviews, 2 stations. One of them is the clinical scenario, and the other one is your portfolio station. يلا الحاجة الكويسة, and this is unique to psychiatry, and I think this just goes to show how much they want to give people a chance. And diamond, people think the interview process, I know that in surgery and medicine and in other really competitive fields, it's super cutthroat, it's super, you walk in, it's a clinical scenario, you have no idea what you're going to be asked. Psych is different. So in psychiatry, 2 weeks before the interview, or I think maybe 10 days before the first interview, the questions are actually released. يعني تكون خاش الانترفيو and you know exactly what you're going to be asked. So they release the clinical scenario. The portfolio station أصله هو واحد, it doesn't change. So I'll give you an example. So for my interview, the clinical scenario, which is a very common scenario that I think most of my friends, if you're working in A&E, you will know of this scenario. So it's basically a 21-year-old female comes into A&E. She's taken an overdose of paracetamol. You're the psych SHO on call. She's been medically cleared, and you've been asked to see her because she wants to leave. But the medics have told you that she needs treatment. إنه paracetamol level حقها عالي وهي محتاجة treatment, but she's asking to go, and they ask you to see her. What do you do? So I'm not going to answer that question, but that's like it's a whole other thing. Like, that's just to give you an example of the style of questions. That's the clinical scenario station, and they so you have the scenario قدامك بتكون عندك it's always an actor زي باقي الامتحانات, and you have the examiners. The examiners for clinical scenario, they won't talk to you at all. You have the first part, you're doing the station, but that once you finish the clinical scenario, there's going to be like 5 minutes at the end where they ask you questions. That's an example. A portfolio station, and I think this is by far like the most important part, because the clinical scenario, you can practice, you can talk to your colleagues, you can always يعني to improve في الحتة دي, and your communication skills. The portfolios is a bit different. Yeah, I've gone to interviews. I've seen people carry like folders of like, you have 15 minutes. Like, ما عارفة الناس دي شايلة حياة. You've got 15 minutes to basically talk about what you've done, why you should be doing psychiatry. For me personally, it doesn't make sense to talk about every single thing you've done since medical school. No one cares. Like, seriously, bitch. Yeah, and I always tell people, like, if you're an examiner and you're sitting there and you have 10, 20, 30 people in the same day and they're just talking to you, and it has to make sense. يعني انت عندك زمن محدد. You've got a limited amount of time to basically sell yourself. You're thinking about it as a sales pitch. You've got 15 minutes to sell yourself in the best way that you can. Don't waste it for kalam farag that has nothing to do with psychiatry. And there's lots of things that you can say that will boost your application. So just going back to the person specification, في portfolio, it will tell you when they release the questions, the points that they expect you to cover. For example, I'll give my personal example. كنت شايلة folder. You should have a contents page. Being organized and just making it user friendly, because you're basically sitting on a desk. Examiners are on the other side. You have your portfolio upside down and you're talking. You're basically talking. I'm not saying تحفظ الكلام, لكن just be aware of the practical things about portfolios, because I think, and the stations, I think this is where people lose marks. I think portfolio stations, generally people don't like them. I personally don't like them because I just don't like talking about myself. And with him, you have your contents page. They want you to cover teaching, research, your clinical competencies that have showed that you've acquired what you need to do for the foundation, publications, posters. If you have any other extra degrees or masters, I mean, فأي حاجة أنت شايفها مفيدة ممكن تساعدك, but not because you think it's like, if you've done something that's not really related, like you have to balance. If you have lots of different things you can talk about, choose wisely about what you're going to present, because that's what they're going to mark you on. I think a lot of people جايين من برا, they يعني, and that includes me. Like, أنا قريت في السودان, جيت هنا, it's just practicing. يعني أنا البورتفوليو ستيشن دي قعدت مع أصحابي, الناس who are doing psychiatry, and you just need to practice. It's a conversation, it has to flow. Sometimes the examiner will interrupt you and ask you a few things about your portfolio. So أنا كنت خاطة مثلا, we know here in the UK people who have portfolios, you'll have all your work-based place assessments, هم case-based discussions. You'll also have things like a 360 tab, but here that's really important. So the 360 tab is basically people who work here, they know it's basically how your other colleagues شغالين معك, how they view you. If you have any really nice comments, خطها في البورتفوليو. If you got a really good recommendation from a consultant, a letter, أي حاجة يعني that shows you in a positive light, because ultimately what people want is to know that you're أول حاجة, you've got the competencies. A knowledge base دي كلنا نحنا خلصنا foundation, or we've got the knowledge base. لكن are you a team player? Do you مثلا go out of your way to do teaching? فكل الحاجات اللي في portfolio station دي, just if you look at the link, you'll see, for example, what is required of you. It's just, I would say that's practice. So that's بالنسبة. Is that okay? I'm gonna move on from the application and I'm just conscious of time and the process, and talk about a training zato. So okay, I'm just looking at the comment. Okay, so basically you've applied, you've got your CT1 job. What next? So training in psychiatry, it used to be run through, it's not anymore. It's now 6 years or 7, depending if you choose one, or dual training. For core training مقسوم ل3 سنين, CT1 to 3, and higher training is ST4 to ST6, with an option to start ST7 if you decide to do dual specialty. For what's expected of you in CT1 to 3 to achieve your foundation your core competencies for core training, and you're also expected to complete your membership exams. اللي هي ال MRC Psych exams اللي هم حاليا they're 2 papers and a clinical, part A or part B, well clinical exam which is called the CASC. I think أنا ذاتي before I started training ال MRC Psych exams have a reputation of being really difficult exams and ما في زول بينجح. That's not true. Like I think with all the membership exams, regardless of the specialty for the Royal College, I think, and a lot of my friends who are doing other things, GP, medicine, surgery, A&E, membership exams حاجة والpractice حاجة, and I think that's what people trip up on sometimes, that these exams بس عايزة practice exam technique. I'll talk about the courses that people might find helpful. So CT 1 to 3 تخلص امتحاناتك, part A or part B. I've put a resource online في حاجة اسمها SPMM course. That's like the go-to course. يعني إحنا we don't have الحاجات اللي بتستعملها ناس medicine, like it's completely different. So, but that's probably one of the best courses that everyone that I know that does psychiatry used. So it's basically they have online resources and question bank. غير question bank في notes, so there's notes for all the different things they're expected to cover. So part A, which is basically the basic sciences for psychiatry, ففيها حتلقى حاجات like the history of psychiatry, psychology, and definitions في حاجات معينة. Part B, it gets a bit more complicated. This is the paper that I truly hated because it has a lot of like statistics و critical appraisal وحاجات زي دي. فالمهم الكاسك هو clinical exam 18 station مقسوم على 2 parts, morning and afternoon, and there's 8 stations each, اللي هو بس basically assessing your communication skills. فالامتحانات دي my advice is start early because there's 3 exams in 3 years. Unfortunately in psychiatry الامتحانات they're not as frequent like GP or medicine. I think for the papers they all have 2 sittings per year. والكاسك مرتين في السنة, usually around January and September. The frequency or the infrequency of exams, that's why I would advise if you started CT1, يعني I would just start, you know. أنا تعثرت في paper 1 مرة, I had to take part A twice. الحمد لله الباقي يسلك. Just because we know the nature of these exams, يعني it's marked on a curve, that would be my advice بالنسبة للامتحان. I'm just gonna, is that clear so far? I'm not talking too fast, everyone? Okay, cool. So, basically, what do I talk to so far? So, talked about the exams, talked about application. What does core training look like? Like, what does your day-to-day practice look like? فأنت as a core trainee, you're going to be on the on-call rota. حتكون مسؤول عن clerking patients, you know, the usual stuff that you do on the ward, like writing up ward rounds. The main difference, I think in psychiatry, I think people sometimes forget about is the limitations of the access to physical investigations. And if you're an inpatient unit in psychiatry, you can do bloods, you can do an ECG, you're expected to do a physical exam for your patient. Everything else, you'll have to refer to acute hospitals. يعني ما حتلقى إنك أنت يعني if you have a dehydrated patient عايز تديه IV fluids in a psychiatric hospital, no. You're gonna call A&E, you're gonna call the medics, and they're gonna get annoyed with you because for some reason they pretend that they forget that we can't give IVs في المستشفى. And that's simply a safety precaution. If you think about it, if you're mentally unwell and you have a needle in your arm giving you fluids, that's not like a good idea. So that's the one thing that people need to be conscious of. In the intel zone, if you're on call, you're responsible for like all the medical stuff, but you're going to be speaking to medics a lot if someone needs some medical attention. Yeah, الشغل ذاته, it depends on what kind of placement you are in. I was really lucky. I got a very widespread experience. So there's mandatory posts that you all have to do for core training. You all have to do 6 months of an inpatient general adult. General adult is 18 and above. And you have to do an old age psychiatry post. بالنسبة ل اسمه شنو؟ معلش خليكم معي دقيقة. I'm just going to check the comments. So بالنسبة ل sorry, I think I've got some questions. I'm just gonna check. معلش خليكم معايا دقيقة. You have a very bad reception. Okay, I don't know. Can everyone else? Batul, معلش salam. I can see your comment. Can everyone else hear? Okay, is it just Batul, or do I need to fix something? If anyone can just tell me if the reception's all right. Okay, I'm gonna continue because I haven't had anyone else say anything. Is it still مودة زي? Is it still a run through 4 years? No, it's not. I'll just repeat that. So it's مقسوم ل 2 parts. It's 6 years. 3 years CT1 to 3 or 3 years ST4 to 6. Okay, thank you Inas and Tasneem. You can hear me. تمام. بتقول معلش شايفاك رسالتي. I'll get back to you. If I was talking about core training, it depends on the setting. If you're an inpatient setting, you're an outpatient, you're seeing patients, you're clerking them, you are prescribing medication, but that will always be the consultant's decision. And within your core training, you'll do the mandatory general adult old age في سنة ونص تقريبا, and then the other 3 placements you have a choice. So I did child psychiatry and I did rehabilitation psychiatry. So you can either experience a forensic setting, intellectual disability, which is learning disability. I think when you get to the point of core training, when you're starting to think about the options that you have, that's, I'll talk about that later for the higher training. So yeah, exams, exams start as soon as possible. الحاجة الثانية that I forgot to mention that for there's 2 entries per year for applications, which is giving more people opportunities. So for core training, في August intake وفي February intake. So that's something just to bear in mind. So core training, you finish your 3 years, you've done your exams, you've got your competencies. طبعا الحاجات المفروض يعني كلنا شغالين هنا, you know that you have your ARCP at the end of each year, and you're expected to complete يعني زي any other specialty, your case-based discussions, your assessments, تخلص الحاجات دي كلها, and each year you'll be asked about them in your ARCP. منهم you're expected to complete an audit per year برضو. There's also another competency that I'll talk briefly about in core training, which is your psychotherapy competencies. دي حاجة يمكن الناس ما عندها فكرة عنها كتير. I'll just talk about it briefly, which is basically that you have to do a long case and a short case by the end of your CT3, and that's part of your requirements for completion of core training. A long case here عبارة عن a psychotherapy case. فأنت basically you'll be seeing a patient in clinic once a week for about a year. It's not Freud and the couch, it's very different to that, but that's just something to be aware of. It's super interesting, by the way, and some people choose to carry on with psychotherapy as a career path. بعد ذاك, the short case, it can be either family therapy or CBT, and that's just inshallah لقدام I'll be posting like more documents so people can if they have any specific questions, I'll try to cover in more detail. Like in حاليا, I just wanted to talk about the outline, the scope of the training, and what's available and how to get in. So you've finished CT3, or actually for the beginning of CT3, you've done your CASC and you're applying for ST4, you're applying for specialty training. What are the different options? يلا مودة قبل شوي أنت سألتيني لو كان 4 سنين, قلت لك no, it's 6 years. So you finish CT3 and then you apply for higher training, and then I'm just looking at the choices. So there's multiple choices that you have as a career. I've chosen child psychiatry. You can choose to be a general adult psychiatrist, an old age psychiatrist. There's forensic psychiatry, there's addiction, psychiatry, there's perinatal psychiatry, and psychotherapy. فدي انت when you're coming to apply for ST4 you have to choose a line بتاعك and subspecialty. Once you've chosen an application, it's actually more straightforward than a core training. An application form للhigher training, it's a very simple form. It's just your basic information, what placements you did in core training, the fact that you've done your exams. That's basically your eligibility. أي حاجة تانية they leave it for the interview. يعني حتى في application form they don't ask you about research, teaching, audit. They don't do any of these things. الحاجة دي كلها بيسألوك منها في الانترفيو. الانترفيو بتاع الhigher training for all the specialties it's عبارة عن 3 stations. You have your commitment to specialty, هي portfolio station. You have leadership and audits, and then you have the clinical scenario. لما أنا قدمت I did the interview يعني like a year and a half ago, so قدمت general adult and child psychiatry. So I was undecided, so there is scope. يعني a lot of people go for more than one interview to increase their chances, and also if they're not sure. Until آخر لحظة I really wasn't sure which way I was going to go, whether I was going to go down the general adult psychiatry route or the child and adolescent. But I'm very happy with my choice. But anyway, so 3 stations. A clinical scenario, it's not hard. Basically, if you've done the الامتحان الكاسك exam, an interview is going to seem really, really easy and very like completely more like less stressful than the exam. For a clinical scenario, you have 10 to 15 minutes. I can't remember exactly. Like in your same thing, you're given an actor. The questions برضو بالمناسبة للhigher training, they're all released like 2 weeks before. So whichever discipline you've decided to go on, CAMS, general adult, addictions, question بتاع clinical scenario بيكون مكشوف. It's already available to you, so you know what you have to prepare. The second station is leadership and management. So this is basically برضو the questions are released. It's leadership and management, and I just need to amend an audit برضو. So half of the station you're talking about the audit cycle, what your understanding of an audit is and how it can be effective. And the second part of the station is to talk about leadership. So it's basically what you consider to be a good leader. What have you done for a leadership day? It's يعني ممكن تكون from leading a ward round, from going to meetings, following your clinical director. كل الحاجات في البلد دي يعني it's not hard. It's basically what I'm trying to say. And then the portfolio. You're all marked in terms of percentage. The portfolio station, again, similarly for core training, you have person specification. And it's a checklist. Like I literally, I was very lucky. I have a friend of mine, and I'll say shout out to Tom Milnick, who really helped me with my application. Like, basically, you should practice. So basically, you have to give the person specification بتاع الhigher training, and you look at all the different points that you need to cover. For everything that's in the person specification for higher training, the specialty that you've chosen, whether it be general adult, whether it be child psychiatry, فكل الحاجات مكتوبة في person specification they expect you to cover, whether it's desirable or essential criteria. Essential criteria طبعا دي essential, you have to cover it. وأي حاجة زيادة بتضيفها. Again, for this portfolio station you need to be even more selective. يعني أنا ماشية interview بتاع child psychiatry, and you know if you don't have another option, if you're going to talk about audits and you haven't done any audits in child psychiatry, fine, then talk about it. Like if you see where I'm going, and if you've done enough things and shown interest in the specialty that you've chosen, that will improve your chances. And for example, it was helpful that I did a placement in child psychiatry, so I had a lot to talk about. And that's just the general gist of things. Higher training. So that's the interview. ما صعب يعني الstations نفس النظام زي كل other specialties. And once you've chosen, it's 3 years. في فرصة إنك أنت تطلع dual CCT, so you'll have a CCT in 2 specialties. For example, at the moment there is a combination of general adults and old age, or general adult and liaison psychiatry. You can do child and adolescent psychiatry with forensics, and in that case it would be 4 years, not 3. It would be ST4 to 7. Like, and if you're choosing a single specialty, it's ST4 to ST6. There's been lots of rumors about whether they're going to introduce an exit exam, but so far, alhamdulillah, there's not any. Let's just keep hoping they don't. So once you've done your membership exams, that's it. Khalas, there's no more exams. For in your higher training, you have your competencies, you have your ARCPs, you have other things that you need to do. Your responsibilities change, of course. Yani, for example, I'll talk about my colleagues, some friends of mine, they're doing general adult. As a registrar, أول حاجة, in most places, you're on call from home. Yes, I said on call from home. Yeah, just that's another incentive. You're on call from home, but you're usually covering multiple sites. يعني ما بتكون قاعد زي very, very rarely. But so as a registrar, you're expected to to do patient reviews. You're leading ward rounds. You will be starting medication, and you'll be writing reports. And then I think I'll just talk about it briefly. We have 20 minutes. I'm going to talk 5 more minutes كده, and then I want people to ask me questions if there's anything they want me to go over. So the Mental Health Act is kind of what we use a lot in psychiatry, and what does that mean? The Mental Health Act is basically a law. It's a detention right that psychiatrists or trained psychiatrists have the right to detain people. يعني نحن, if someone's acutely unwell, they're psychotic, or they're at risk to themselves or others, then psychiatrists have the power. And to basically keep people in hospital against their will, if it needs be. It's not a decision that you can make alone. So basically, for any assessment under the Mental Health Act, you need to have 2 psychiatrists and a social worker. And the qualification that you need to have is it's called Section 12. It's basically you just attend a course for 2 days that talks about the Mental Health Act, the legal frameworks that we work with. But it's basically that's also something that you should do either at the end of CT3 or the beginning of ST4. تعمل الكورس ده, فأنت when you start as a registrar, you need to be what they call Section 12 approved. So you have this piece of paper that basically means that you can section people. And unfortunately, it's not a part of my job that I particularly enjoy, but it is a necessary part of my job, because as we know in psychiatry, some people don't have insights and you're acting in their best interests. Anyway, so as a registrar, when you're on call, الحاجات اللي ممكن تشوفها شنو, and people often ask, انت يعني you're on call, psychiatrists don't do any work, and that's not true. You're going into A&Es, you're going into police stations sometimes. But it's a very kind of different landscape that you're working with. You're not always inside the mustashfa. You could be going to a prison. It really differs, the field that you've chosen. The area برضو makes a huge difference. يعني London is super, super busy. Most of the south is busy, and that's mainly because the population, المشاكل الاجتماعية, drugs, all of these, poverty, all of these different things play into psychiatry. And I think a lot of my friends who are working in A&E will know that they see a lot of psychiatric patients in A&E. So you basically you do your ST4 to 6, depending on your specialty. You've got your ARCP at the end of each year, and then you, inshallah, once you've done that, you've gotten your CCT, which is your certificate of completion of training. What are the chances of you getting a consultant job in the UK حاليا? Pretty good. Everyone that I know قدامي شغالين معي at the end of ST6, I would say more than 95% all got consultant jobs straight away, and very few other specialties can say that. And that's mainly because not a lot of people want to do psych, or it's not saturated. يعني one can say that until now, even in London, there are posts, it's not a saturated specialty. So that's I guess it's an incentive. What are the alternative routes? I know some people, and مثلا if you've done some psychiatry outside وجاي مثلا خلصت امتحانات, some people have already done their membership exams وجايين على ST4 level. Yalla, I wasn't aware of this, but I found out recently from a friend that there is something called a CESR, which is an alternative pathway to CCT. It's equivalent to a CCT. You can work as a consultant في البلد, but I think there are some restrictions to other countries. So that's something that some people need to... So there's a question. Muwadda, can you please post the best sources for studying? Yes, I will. Muwadda, if you go to the group, there is a document. كنت نزلت قبل. It's basically just an outline of what I've been talking about today, and I've added resources for part A. But I'll tell you now. So SPMM is the best one. That's my opinion. برضو, you can use MRC Psych Mentor, but SPMM is like that. Stick to that, and you're good to go. So yeah, CCT. So I've talked basically, I think I've covered all the points I want. We've got 10 minutes left, Ishabao. So I'm just gonna recap some points, and please feel free to ask questions. And also remember that I've uploaded a PDF file in the group that talks about the different sources for question banks and imtihanat courses, basically everything that I've said today. If there is anything else that I've missed out or that you're not sure of, then please post in the group, and I'll respond when I can. If I don't respond immediately, don't take it personally. It's basically because I'm at work or المهم يعني, I'll get back to you. What about MRCP part 1? Which Abdurrahman, salam alaikum. I'm not sure. Do you mean MRC Psych and Psych exam part A ولا MRCP الامتحان تاع ممكن توضح لي سؤالك معلش, and then I'll respond. So just to recap the points that hopefully I think I have covered today. So psychiatry, what it looks like today, and just to the basic material for undergraduate. Okay. Let me think about that, because there are lots of different books and resources for Abdurrahman. I'll send you, I'll answer بعدين. I'll just have to check the updated materials, because and I'll remember honestly في السودان في لما كنت في مامون يعني our exposure to psychiatry was تجاني الماحي, was Kober, and it's very, I know like psychiatry is one of the lectures that people don't even necessarily go to. It's limited what we're expected from as undergraduate level. Like so I have another question. So Muhammad Al-Ashari, Assalamu alaikum. So I would like to ask about clinical gaps almost 12 months, which sounds like a barrier from getting the job. Okay, I think that's a general question. I think كان في فيديو تاني الناس سألت عنه, لكن I'll do my best to answer anyway. A clinical gap, it does, it's not necessarily a barrier. It's only a barrier if you can't show what you've done in that year. أنا بعرف ناس كتار تأخروا في امتحاناتهم أو خلصوا امتياز برا, or they have a gap. If a gap that you've not been working, you can justify. يعني أنت مثلا لو كنت بتقرأ الامتحاناتك, you can say that you've been preparing for an exam. If you've been studying, if you've been working in something else. When you come to apply post-registration, الفكرة is you just have to be able to show what you've done in those 12 months if you've been out of clinical practice. I hope that answers your question. Just another thing to mention about the exams. I know for medicine and surgery, lots of people, they do part A or part 1 قبل ما يخشوا training, and to improve their chances of getting into core training. That's, I would say it's completely unnecessary. يعني هنا في البلد دي انت لما تكون ماشي ل CT1 interview and you've done F1 or F2 here, no one expects you to have done your psychiatry exams, and everyone does them within our core training. Inas, salam alaikum. What do I think about training in Ireland compared to the UK? If I have any idea, that's a really good question. I don't have any friends who are doing psychiatry in Ireland. But one thing that I can say is the laws and the system are very different. So even here in the UK, England, Northern Ireland, and Wales, when you're applying for psychiatry, that's where you're applying. And Scotland has a different system. So application, less Scotland, and the Republic of Ireland are separate to England, Northern Ireland, and Wales. So today I've been talking about England, Northern Ireland, and Wales. Sorry, I should have made that clear. Inas, but I'll look into it, Inas, and if I can find some information, I'll get back to you. Muwadda, it's not essential to finish part A? No, it's not. It's not going to. It will make your life easy. انت لو نزلتي core training, لو عندك طريقة to do it, it will make your personal life easier. When you're starting your exams, you have 3 years to clear 2 instead of 3. But it's not going to make a difference for the application, because it's simply it's not going to give you extra points. But the flip side of that, and this is what I mean about being creative with your application. So if you haven't done an F1 or an F2 job, you haven't done a taster, you haven't got anything in your portfolio to say that you're interested in a career in psychiatry, and yet you've gone to the trouble by completing the first exam, you can spin that, I guess, to say that you're serious about this career. Like in ما يسألوكي في interview, they won't ask you about exams. It's not expected. So I hope that answers your question. Muhammad, you're welcome. No problem. Is there any other questions that people have before I start winding up? So today, inshallah, we talked about I talked about just the background of psychiatry, what it is to be a psychiatrist in the UK, why I think mental health is important. At core training, we talked about application process, exams, the courses, what practice looks like. And then I also talked about higher training, an interview, and briefly about CCT. This is just a really rough over. I think it's hard to بجد عايزة أحيي SJDA group for all the videos, كل الحياة الكويسة اللي بتعمل فيها في السودان وهنا. And it's not easy to talk about a specialty in 1 hour. Like we've got a question, Ashraf. What are the chances of getting into core training right out of the bat, just like after getting your GMC, having done your internship overseas? Okay, that's hard. I won't say they're slim. I'll say there is a chance. Like you just have to be smart about your time. فأنت basically, let me just double check that I've got you correct. So you've got your full registration. عملت الامتياز برا وعايز تخش core training. يلا, and this is applies to any specialty, not just psychiatry. If you haven't done your imtiyaz here and you're fully registered, you still have to have your foundation competencies. And if you haven't done your foundation training here, there's still a process by where you have to, whether you're doing a locum, whether in the consultant fee form, I'm trying to remember if anyone else can remember the name. It's basically to prove that you've done my يعادل foundation program. But if you can prove that you've got the competencies or my equivalent to with this form, then you can use that to apply to core training. Does that make sense? But yeah, what I think I'll do from today is I'll go back and look at the questions that everyone asked, and I'll write some written answers and I'll post them in the group, because it might be easier than going back to the video. وكذا. Any final questions before I round this up, Shabab? If there's any other questions that people ask, Ashraf, Muwadda, you've asked a few questions. If not, hi Ahmed. Sorry, just saying hi to people casually on Facebook. So today was the talk about psychiatry training in the UK. I hope that everyone found it really useful. And if there's any questions in the comments, Murtada, you're welcome. I hope that. Thank you, Muslim Alternative Certificate of Foundation Competence. There you go. There's your answer. Yep. I hope it was useful. I want to thank SJDA Group again for giving me this opportunity. Inshallah, it was beneficial, and I hope that this has given some people some more information about psychiatry and whether or not it's something that you would pursue. Someone asked a question. She asked a number. I forgot her name either. She asked me basically, what is the training? Are psychiatrists happy? I think so. I think if you're thinking about work-life balance, psychiatrists have a pretty good work-life balance. And personally, I love what I do. So, but that's, yeah, you can call that personal bias. But anyway, I'm gonna call it a night. I hope that was useful. Thank you, everyone. Assalamu alaikum.